My name is Ladislav Timulak. Ladislav, the short for Ladislav is Latso, so I can be referred to as Latso as well. I'm a professor in counseling psychology. I'm based in Dublin, Ireland, although originally I come from Slovakia, hence my accent may not sound like totally Irish. I am a psychotherapy researcher, and I'm also a university professor, and I'm a trainer in psychotherapy and so on. One of my main area of interest is a development, further development and adaptation of emotion-focused therapy. And today's class will be, or today's lecture will be focus on this type of therapy. We will go through kind of sort of introduction into this type of therapy, and we'll go through some main kind of concepts or constructs that are relevant for this type of therapy. But we'll learn a little bit about how therapy actually looks like. So I'll just continue with some slides on emotion-focused therapy now. So what we are trying to do in emotion-focused therapy, we are trying to get to underlying chronic emotions that are somehow defining, and they are too difficult to be with, and in that sense they're maladaptive. You know, experiences of fear may not be maladaptive necessarily, or experiences of shame or loneliness. You know, I may feel alone and I may reach out to others, and that may be very, very helpful and adaptive experience of loneliness. I can also do something bad that harmed important people to me, and I may feel shame, and that shame may lead to repair and amendments on my part, and may be very adaptive. So we are here talking about experiences that are maladaptive in a sense that they do not inform any adaptive action, that they do lead to experiences that we can't live with, or that they're too upsetting, too distressing for us to function with them, and for them to inform any adaptive action on our part. So even this experience, apparently, that we watched with Claire, is somehow pivotal to how she is. I mean, it's not only this experience, but it was quite pivotal in how overprotective she's of her daughter. So what we are doing in therapy, we are trying to kind of activate those kind of chronic painful feelings, and we are then trying to look at specific triggers linked to them, but we are also trying to kind of transform them in therapy. How it shows is we'll use something like, this is a map for what's happening in therapy. You see triggers there, global distress and so on. So we see here a trigger is, I may lose my daughter. Yes? So there may be a trigger. There could be problematic self-treatment. It's all my fault. I didn't protect her or something. We didn't see that, but it could be. Yes, there could be problematic self-treatment in that context. There's a core pain. I'll lose her. So there's a fear, and there is maybe some sadness. Yes, I'll lose connection. Yes. There could be a lot of anxiety. From now on, there's a lot of anxiety present. I may lose her again. Yes, or I don't want to have those feelings I had back then. So I better make sure, and this goes to the, we see arrows there to emotional avoidance and behavioral avoidance. Behavioral avoidance, I will ensure that I may not lose her again. So there may be, checking on her, making sure that whatever is happening with her, it's definitely safe, and so on. There may be on a global distress level, that's more secondary distress, is I have a lot of anxiety, yes? But at the core is, I have that experience of missing you, and I'm scared of losing you and myself. We will have a look at it again. And this is the core pain that we will try to transform in therapy. I'll be returning potentially to this slide later on in therapy. This is another variant of this slide in different colors, but it's basically the same slide.